Good morning and welcome. We appreciate your taking the time to be with us for this important ceremony. Today, the students of our Year 1 class will take an oath of ethics for the profession of dentistry. I would like to begin our ceremony this morning by acknowledging our faculty who represent both the biomedical and the clinical sciences at the School of Dental Medicine. Our faculty has consistently demonstrated to be among the best in the nation, and our students' past national performance has verified this. Each year, the dedication of our faculty helps to produce some of the finest dental practitioners in the nation. I anticipate that the class of 2015 will be no exception. Thank you, faculty, for all that you do so very well. Audience, please join me in a round of applause for our faculty. Our next welcoming remarks will be made by Dr. Ann Boyle. Dr. Boyle recently left her position as Dean of the School of Dental Medicine to fill the position of Southern Illinois University Edwardsville Interim Provost and Vice Chancellor for Academic Affairs. It is my great pleasure to introduce to you the Interim Provost and Vice Chancellor, Dr. Ann Boyle.
Good morning. As Interim Provost for Southern Illinois University Edwardsville, I officially extend a welcome to you and to your family and friends on behalf of the university. Class of 2015, you were selected from a very competitive applicant pool, and you were selected to participate in the university's dental medicine program. And in a university that is experiencing growth and recognition for the quality of its programs, there is no doubt that this dental school is the premier professional program of this university. Now, changing hats for a moment, I'm going to talk to you as the former dean of the School of Dental Medicine and congratulate you on being accepted into one of the very best dental schools in the country, one that is dedicated to excellence in dental education. As you are discovering, the faculty expectations for your learning are high. Mastering the clinical skills so that you can safely treat your patients is going to take much practice, and I'm sure you have discovered that it can occasionally be frustrating. Is that a good word? The demands on you in this program will be intense, but not insurmountable. And the goal of the Doctor of Dental Medicine degree is well worth the effort. When you finish our program, you will be well prepared and you will be ready to practice dentistry. In this first year, though, that is so heavily loaded with information on biomedical and clinical topics, the ethics of patient care can get lost. But you must realize that the objective of all your hard work is to treat patients and to treat them well, to respect their autonomy in making choices about their care, to protect their privacy, to never cause them harm, to treat them fairly and honestly, to promote and protect their welfare, to put their needs above your own, to treat them as you would want to be treated. The public holds the dental profession to a higher standard than others, and your entry into our profession does not begin at graduation. It begins today. Therefore, I urge you to always remember the principles you have learned in preparation for today, and I urge you to incorporate them into your behavior every day going forward from today. In closing, I welcome you to the profession of dentistry, and I very much look forward to seeing you at your graduation. Thank you.
Thank you, Dr. Boyle. We all miss your presence and your guidance at the School of Dental Medicine, and we wish you the very greatest of success in your new role. When hosting an event such as this, we're very fortunate to have sponsors who provide much-needed support to make the event possible. The sponsors for today's event are the Central Illinois Academy of General Dentistry, the Illinois State Dental Society Foundation, the 8th District of the International College of Dentists. I would like to take this opportunity to introduce a few of our special guests who are representatives of these organizations and who are joining us on stage today. I would like to ask that each of our guests please rise as you are introduced. And also, I would like to ask the audience if you would please hold your applause until after all of our guests have been recognized. To begin, Dr. Cy Wachtenheim. Dr. Wachtenheim is the Regional Director for the Academy of General Dentistry. He is a past president of the Illinois Academy of General Dentistry. He is also a member of the Continuing Education Council of the Academy of General Dentistry. Next, Dr. Don Silfies. Dr. Silfies is past president of the Illinois Academy of General Dentistry. Dr. Silfies is also an alumnus of the School of Dental Medicine, receiving her degree in 1984. Next, Dr. Susan Bishop. Dr. Bishop is the program director for the Central Illinois Academy of General Dentistry. She is a past president of the Illinois Academy of General Dentistry. She also serves as editor of the Illinois section of the American College of Dentists. She is a member of the board of directors of the Illinois State Dental Society Foundation and chair of the Illinois State Dental Society Foundation's Dental Student Research Committee. Dr. Bishop also currently serves as president of the Illinois Foundation of Dentistry for the Handicapped. Next is Dr. Luann McLean. Dr. McLean is the president of the Illinois State Dental Society Foundation and a past president of the Central Illinois Academy of General Dentistry and the Illinois Academy of General Dentistry. She is a fellow of the International College of Dentists. She is a member of the board of directors of the American Student Dental Association and an Illinois State Dental Society Foundation benefactor. Dr. McLean is also an alumnus of the School of Dental Medicine, receiving her degree in 1980. Next is Mr. Jay Landers. Mr. Landers is the executive director of the Illinois State Dental Society Foundation. This is his first year in the role, so we welcome him to the organized dentistry community. Next is Dr. J. Barry Howell. Dr. Howell is the president-elect of the Illinois State Dental Society. He is also a member of the board of directors of the Illinois State Dental Society Foundation. And last, Dr. Darrell Beard. Dr. Beard is the immediate past president of the Illinois State Dental Society. He is also a member of the board of directors of the Illinois State Dental Society Foundation. He is a fellow in the Academy of General Dentistry, International College of Dentists, and the American College of Dentists. Dr. Beard is also an alumnus of the School of Dental Medicine, receiving his degree in 1983. Please join me at this time for a round of applause for our guests and their sponsoring institutions. At this time, I am particularly pleased to introduce our keynote speaker for today, Dr. Peter Paulson. Dr. Paulson is a School of Dental Medicine alumnus of the class of 1978. He is currently Vice Regent of the International College of Dentists, 8th District. He is editor of the International College of Dentistry, 8th District newsletter. He is a fellow of the International College of Dentists and the American College of Dentists. He is a past president of the Illinois State Dental Society, and he has served the Illinois State Dental Society in a number of roles and on a host of different committees. He has served as a delegate in the American Dental Association House of Delegates. He has also served as an American Dental Association representative to the presentation of the first Surgeon General's report on oral health. He is a past president of the Decatur District Dental Society and remains an active member of that organization. He received the School of Dental Medicine Outstanding Alumni Award in Leadership in the year 2000, and during that same year, he earned the Illinois State Dental Society's President's Award for initiating and implementing the Take Two program, which provided dental care to foster children in Illinois. On a personal note, Dr. Peterson has been married for 37 years to his wife, Julie, who is also a dentist and an alumnus of the School of Dental Medicine class of 1979. They have 3 married children, Michael, Tony, and Debbie, and 4 grandsons. My acquaintance with Dr. Paulson and his wife, Julie, goes back many, many years, and I won't say how many. And they have been truly guiding lights in the profession of dentistry. Please welcome Dr. Peter Paulson.
Dr. DeClue, you read that just like my mother wrote it. Thanks so much. Now, a lot of time has passed, and my wife, Julie, could not be here today. She was at a memorial service in North Carolina, Winston-Salem. An uncle who was a retired physician, 91 years old though, passed away, so she could not be here. But Julie and I went to SIU together. We started in 1975, but we ended in different years, I in 78 and hers in 79, because we had a surprise pregnancy in the first year. We thought our world was coming to the end. And then after Michael was born and Julie was back in the program again, she decided, well, since the family was on the way, she wanted to be pregnant again when she graduated, so we worked on that, and that happened. And she figured she'd be 5 months pregnant at that time and her belly would be flat like the first pregnancy, and that was not the case. Her gown was out further with the second pregnancy. But anyway, yes, we have 3 children, 2 boys and a girl. Anyway, thank you for having me this morning, and the first thing I want to say is congratulations. What a wonderful day this is for you, your family, and friends. This day represents a significant step into the realm of the dental profession. It is a day that is respected by the leaders in the profession nationwide. You are the future of the profession. In a short while, you'll be taking an oath that means more than the words printed in a program. It is a commitment to what I will refer to as the 3 E's: ethics, excellence, and empathy. Each of these, ethics, excellence, and empathy, in dentistry, you could spend several days discussing in seminars and we have 5 minutes. But if you look at the dental oath, you'll be taking in a few minutes. There are 10 statements. There is some crossover between each of these statements and the 3 E's, but by far the majority, 7 out of 10, either directly or indirectly, deals with ethics. In your profession, the American Dental Association, it has an entire council, the Council on Ethics, Bylaws, and Judicial Affairs, which has developed a book on dental ethics. I'll be honest, I haven't read that book from cover to cover, but it can be distilled down into the phrase, if it feels wrong, it probably is wrong. And if you have any question, you can look it up. I'm fast forwarding, but I hope that most all, and I hope that all of you will make it through this program, and you will be tempted and put into awkward positions to write a prescription for antibiotics or pain relievers for yourself, your family, staff, and or patients for a sinus infection or the latest strep throat infection going around in your community. Patients will ask you to run through insurance this year on procedures that you will do next year so that they will have their full benefit intact for the next year. And the list goes on. But it happens now. Even before you were seated here this morning, I am proud of one of the students seated here this morning, Adam Fitzgerald, who attended Millikan University, worked in Julie and my practice one summer, every Wednesday, all day long, for a course that he was taking in college. He did it to observe and to work. He did it every day with enthusiasm, skill, and most of the time with a smile on his face. And he did it without pay. That was part of the course. I remember early on I mentioned that I could put him on the payroll. It was a write-off for me. He was part of our operation, and I was grateful. He said that he could not accept any payment, and he was right. And in my estimation of him and my respect of him increased tenfold. And that's the way it works. Thanks again, Adam. But each of you has done the same thing. I know it without knowing you personally. You are here because of it. You have been carefully selected by individuals seated behind me who have sensed it in you. I know this faculty and administration, and they are the best. Would you join with me in an appreciation for our faculty and administration? Follow them, listen to them, and learn everything you can from them. And a natural aspect which flows from this is excellence. Speaking of learning, when I was in dental school, I remember being in the pediatric dental clinic, and there was a wonderful child. As you've heard, I have 3 married children, and each one has a child of their own now. I have 4 grandsons, and my wife hopes that the next one that may come along might be the other side of the aisle. The oldest is 5, Gabriel, and he's had 2 cavities, one filled by his grandma Julie and one by his grandpa. And he extols that story. He loves that. And, but back in dental school, to this day, I just love working on children. They're the sparkle in my practice. I'm a general practitioner. I don't know if I could be a pediatric dentist, but I love working on kids. But this one little girl back in dental school, I remember her. She was a wonderful child. And we did her workup, and I remember as part of that workup, I noticed that some of the dentistry she already had done by a dentist in this local area, I didn't think was very good. It certainly was not the beautifully carved fillings that I had done in preclinical, exercises at SIU. And I told the mother that. And so then it came time for me to do a filling on her. This wonderful child turned into a very squirmy child. And when I was done, I realized that the filling that I had done, which I got credit for, and it was adequate, probably didn't look as good as any of the other fillings that were in her mouth. And I learned back then, very early on, not to disparage someone else's work until you have been in their shoes or know the circumstances under which that dentistry was done. The main point is do your best. Bring all the knowledge, your confidence, and excellence in all that you do. And empathy. Have a heart for the patients you serve. You will be the only one licensed to do dentistry and all that entails in your community. No one else in the medical community can perform the procedures that you do. If patients are in pain, they can go to the emergency room and receive temporary help with pain medications and antibiotics, but no one else can do the definitive work such as an extraction or a root canal to solve a very painful situation. Access to care is an issue in our profession that is aided by practitioners who are willing to help, especially when patients are in pain. As you enter the realm of the clinical, as you don this profession's white coat, remember that it represents not only knowledge and skill, but a real appreciation and concern, and I dare say love for the people we serve. Again, I say congratulations to you all, and thank you.
Thank you very much, Dr. Paulson, for sharing with us the wisdom of your many experiences as a dental professional. At this time, we will present the white coats to our students. Dr. Carnell Thomas will call each student to the stage, and Dr. Thomas, as our students know, is the Assistant Dean for Admissions and Student Services at the school. Presenting the white coats to our students will be two of our faculty members who are also alumni of the School of Dental Medicine. Dr. Susan Rieken is a School of Dental Medicine alumnus of the class of 1995. She completed the Advanced Education in General Dentistry program at the school in 1998, and she completed an implant fellowship at the school in 1999. She is an associate professor working in the restorative section of the Department of Restorative Dentistry. Dr. Rieken was the director of the Advanced Education General Dentistry program at Southern Illinois University School of Dental Medicine from 2002 until 2007, at which time she became the director of patient management teams. The other individual that will be assisting with the white coats is Dr. Dean Drake. Dr. Drake is an alumnus of the very, very first class that ever graduated from the School of Dental Medicine in 1975. He was not only in that first class, but he was the very first student who secured a position in that first class. So, as it turns out, he certainly made a great decision. Yes. And Dr. Drake, since that time, has maintained a private practice in Fairview Heights, Illinois, since 1975. He has been serving the School of Dental Medicine as a clinical assistant professor in the Department of Restorative Dentistry since 2008. He also serves as patient management team leader at the school. Dr. Drake is the president-elect of the School of Dental Medicine Alumni Council. And just as a pause before we begin, I'd like to add that we always consider ourselves fortunate when one of our graduates return to the school to teach, because they make excellent role models for our students who are here now. I would like, in that regard, to extend both an invitation and a challenge to the class of 2015 to also consider giving back to dental education in some manner in the future. As an alumnus of this school and university, you may be the key to the success of a future School of Dental Medicine student. And now we will start with the presentation of the white coats. And Dr. Thomas, would you please come to the podium? And as Dr. Thomas is doing that, I would like to ask that family and friends in the audience, please feel free to come forward to be able to take photos as your student is presented with the white coat. So please do not hesitate to come forward. Thank you. Dr. Thomas.
Good morning and welcome. As I call the first person in a row, I ask that the entire row rise and proceed to the side entrance of the stage and wait for your name to be called. As Dr. DeClue stated, family members should feel free to move forward for pictures. Deanna Adair. Alex Beavers. Nick Bishop. Jillian Brooke. Claire Carroll. Brad Cox. Travis Cripps. Andrea Diaz. Patrick Farrow. Eric Flesher. Adam Fitzgerald. Stephanie Grider. Brian Hamill. Trevor Ham. Morgan Harding. Andrew Hartman. Alex Hawkins. Amy Hazelwood. Josh Heimerdinger. Mark Hobby. Iwana Jakob. Carly Yale. Caleb King. Leslie Klachek. Vance Canara. Jen Larson. Nancy Lynn. Gordon Luong. Richard Luong. Heather Mahasik. Kai Mallarney. Ashley McNeely. Risa Mercado. Elizabeth Moore. Courtney Morgan. Pat Murphy. Michael Neal. Anna North. Megan Aldridge. Brad O'Reilly. Craig Reno. Zach Reef. Casey Santel. Christy Schaefer. Matt Shaughnessy. Lucas Steele. Mazen Sultan. Aaron Sizdek. Kevin Tice. Sarah Tien. Kent Thunberg. Let me be the first to offer my congratulations to the class of 2015.
I now have the privilege of introducing Dr. Bruce Rotter, who is the interim dean of the School of Dental Medicine, who will lead the class in reciting the professional oath. Dr. Rotter.
All right, class of 2015, if you'll repeat after me. As a student of dentistry and as a dentist, I freely make the following pledge. I promise to observe the code of ethics for the profession of dentistry from this day forward. I shall at all times and in all places conduct myself with honesty and integrity. I shall include my patients in all important decisions about their care. I shall obtain consultations and make referrals when appropriate. I will provide absolute discretion and confidentiality for my patients. I shall provide treatment to all patients without bias to race, economic status, or religion. I will conduct myself with compassion, integrity, and professionalism. I will use my skills to serve those in need. I will continually seek new knowledge and skills in the best interest of serving my patients. I pledge myself to the service of humanity, my patients, my community, and my profession. Ladies and gentlemen, once again, we would like to introduce the Southern Illinois University School of Dental Medicine Class of 2015.
As we near the end of our program, we have reserved time for a few words from the Student Council. At this time, I would like to introduce Ms. Rachel Ward, who is a Year 4 student and a representative of the School of Dental Medicine Student Council. The Student Council traditionally co-sponsors the Family Day activities on the School of Dental Medicine campus that will immediately follow this ceremony. At this time, I'd like to introduce Rachel. Welcome.
Hello, as Dr. DeClue said, I am a fourth-year dental student and here representing the Student Council today. I would like to welcome all faculty and parents to the day, and again, welcome you to the lunch that we have afterwards. Most importantly, congratulations to the class of 2015. Today is a very important day and your first step in the dental profession. When thinking of what words to share with you today, I turned to my fellow fourth-year students to see what advice they wish they knew as a first year or what they think is important to know. As you can imagine, I received a wide range of responses, so I'm going to take some time to share them with you today. Among the most popular responses I got were, "Don't do it, just say no. Get out while you still can, and save yourself, it's too late for us." While these are all good pieces of advice, I'm not sure how helpful they would really be in your next 4 years. So I've narrowed it down to about 3 things. The first, take the professor's advice to heart and always be willing to improve. One of the first things you do when you come to dental school is you take a class called dental morphology. In this class, you learn how to make cones and teeth out of wax. So drip by drip, a little bit, you turn this little stick into a tooth. So the first assignment is the cones. So as you guys know, the first thing you're supposed to do is build 3 cones in a row, about 3 millimeters tall. They're supposed to look exactly the same. Well, I know this might be hard for a lot of the teachers to believe, but I was not a very good waxer at first. So I spent that whole first weekend working on these cones. By the time I finished, these were the most beautiful cones I had ever seen in my whole entire life. I could not wait to show them to the professor, and I was for sure they'd probably just bump me up to third year, skip all the other classes because these cones were so wonderful. So after standing in line on that Monday morning, waiting to show them to the teacher, I boldly stepped up and asked him what I could do to improve. The professor looked at the cones, looked back to me and looked at these cones, and just said everything. As you can imagine, I didn't really know what he was talking about at first until I looked at them and realized one cone was pointing one direction, the other direction, and the middle one looked like someone had stepped on it. In dental school, you will be given a lot of assignments and tests, and even though while you might try your hardest, you might not always receive the grade that you thought you deserved or were expecting. The important thing is that you will be improving. Take these advice the teacher gives you and listen to them. Take them to heart. As long as you're taking the feedback, you will improve, and in the end, you will become a better dentist. The next one is to stay organized and make time for yourself. As most of you already know, school can keep you very busy. I remember the days of having 7 quizzes, 3 projects, and 2 tests all in 1 week. It is very easy to not sleep enough, eat enough, or just take time to yourself. So make sure you stay organized and don't fall behind. However, at the same time, it is important that you make time for yourself. Take 30 minutes a day and pick up a hobby. Read a book, go on a run, or play a video game. I can promise you that when you return to studying, you'll be much more energized and ready to focus. Now, when you do return to studying, it is worth noting that while the SDM library closes at 10 or 11, the Steak and Shake on Homer Adams is open all night, and they serve coffee. And then the last piece of advice is to lean on each other and take one day at a time. It is very easy to become overwhelmed if you look at everything at once. Instead, take one day at a time, one project at a time. Become unified and help each other as a class. These next 4 years, you'll probably learn more about each other than you ever wanted to know. There'll be weeks when you'll spend more time with each other than you do your families or your significant other. Find strength in your numbers. Meet to study together and share what you have learned. Help each other out. Some of my best memories in dental school were the times I spent studying with my classmates. I can remember a couple nights we were pulling all-nighters studying for finals. We took shifts sleeping just to make sure that we wouldn't oversleep for the test the next day. So in dental school, if you take the professor's advice to heart, we'll always be willing to improve. Stay organized while making time for yourself, and finally lean on each other while taking one day at a time. You will have a successful dental school career. But most importantly, stay true to yourself. You have gotten yourself where you are today, and this should not be forgotten. Remember how excited you are and how excited you feel today about the dental profession. Take this feeling and remember it. Remember why you wanted to embark on this career in the first place, and remember how lucky you are to be here. While these things are a lot easier said than done, I can promise you that they will help. Good luck with the next 4 years of your education. I know that you all will do great things. Thank you.
That was some great advice. And the only thing I can add to that is when you're in year 1 or 2 of dental school, and you're in the laboratory and someone says to you, "Not bad," that's probably the highest compliment you'll ever receive. So it's not bad, Rachel. Yeah. I'd like to say that this marks the conclusion of our annual white coat ceremony, and I'm asking, would you please join me for one more round of applause for our class of 2015. I would like to remind all of you that everyone is invited to return to the School of Dental Medicine campus immediately following this program. The campus will be open for you to tour, and there will be a luncheon served under a tent in the central campus core. I'd like to thank all of our students, our faculty, our parents, and the relatives and the friends for attending this ceremony today. And in the end, I guess I would like to ask that Year 1 class remain standing for just a few more minutes on the stage so that some additional photos can be taken. And for the audience, you are free to go at this time, but I want to thank you again for attending, and please enjoy the remainder of the day. Thank you.